Hello, welcome to Oh My Health. My name is Karen Howard. I'm a physiotherapist and have almost 20 years of experience in orthopedics and sports physiotherapy. We have designed this video in order to be able to explain anterior cruciate ligament injuries to you. I will show you some phase 1 exercises. Phase 1 exercises are important to do in the initial phase following an injury and a diagnosis. I will also explain some movements to avoid, and I'll give you some basic guidelines in terms of what's important to strengthen and rehabilitate your knee. These are phase 1 exercises. Phase 1 exercises you can do for anything from 2 to 6 weeks. It depends on the severity of your injury and on how fit and strong you were before your injury. These exercises are also available as a downloadable summarized PDF, which you can find on the Oh My Health website. Phase 2 exercises will be coming soon, so be sure to check out Oh My Health and download the next phase of exercises soon. This is a model of your knee joint. This here is your quadricep tendon, and this is your patella or kneecap. If I moved the patella or kneecap to the side and bent your knee, inside you can see that there are two cushion-like structures called your menisci. This is the medial meniscus, and this here is the lateral meniscus. The blue is the articular cartilage. The articular cartilage is what is damaged when you have osteoarthritis of the knee. Then you can see the anterior cruciate ligament, or ACL. The anterior cruciate ligament runs from the front of the shin bone all the way to the back of the thigh bone. The other ligament that you can see in the back is your posterior cruciate ligament, which is less commonly injured. If you have a partial tear of your anterior cruciate ligament, it is possible to return to full function and to your normal sports. However, the muscles around the knee joint really need to be much stronger in order to support your knee and to compensate for the slight ligamentous instability. If you have a complete tear or complete rupture of your anterior cruciate ligament, it is also possible to return to full sport and to follow a conservative, non-surgical approach, but this does need to be discussed with your orthopedic surgeon. What can also happen sometimes is that the medial meniscus and the medial collateral ligament may also be injured when injuring your ACL. If that's the case, you need to once again discuss with your orthopedic surgeon. The medial collateral ligament injury on its own responds very well to conservative management, as does a meniscal injury. We've actually covered meniscal injuries in a separate video, so you can check that out on Oh My Health as well. It is important to accept that the recovery from an ACL injury takes a long time. You may be looking at anything from 4 to 12 months of strengthening and rehabilitation. The length of time that it takes is going to depend on the severity and complexity of the injury, the level of strength and fitness that you had prior to the injury, and your commitment to your rehab program. Unfortunately, having had an ACL injury, you are going to have an increased likelihood of developing osteoarthritis in your knee in later life. Because of this, it's critically important to keep the muscles around the knee joint strong, to wear supportive, good footwear, and also to follow a healthy, balanced diet. Oh My Health is a wealth of information on all of these topics, so keep checking in and keep in touch. Your first exercise is static quads. All you do, tighten the thigh muscle, try and raise your heel and hold it for 5, 4, 3, 2, 1, and release. Tighten your quad, raise your heel, pull your toes up towards your nose, and hold it for 5, 4, 3, 2, 1, and release. Tighten your quads, raise your heel, raise your toes for 5, 4, 3, 2, 1, and release. If you'd like a slightly more challenging version, you can come up to a sitting position. Once again, tighten your quads, raise your heel, pull your toes up, and hold it for 5, 4, 3, 2, 1, and release. Tighten, raise your heel, Raise your toes for 5, 4, 3, 2, 1, and release. And tighten, raise your heel, pull your toes up for 5, 4, 3, 2, 1, and release. You can do 3 sets of 10 repetitions. Your second exercise is called straight leg raises. Tighten your thigh, raise your heel slightly, lift the leg, and slowly lower down. Tighten your thigh, raise your heel, lift your leg, and slowly lower down. Tighten your thigh, raise your heel, lift, and slowly down. If you want a slightly more challenging exercise, come up to a sitting position. Once again, tighten your thigh, heel off the floor, toes up, lift, and slowly down. Tighten your thigh, heel up, toes up, lift, and slowly down. Also, it's a good idea to turn your toes slightly out as that gets the inside quadricep muscle to fire a bit better. Tighten your quad, raise your heel, lift, and slowly back down. 3 sets of 10 repetitions. Your third exercise is to improve your knee flexion range of movement. All you do is bend your knee by sliding your heel along the bed of the floor. Hold it for 5, 4, 3, 2, 1, and slowly straighten down. You can go into slight stiffness and a little bit of discomfort or pain, nothing more than a 3 out of 10. And slide it down, and slide up, hold it for 5, 4, 3, 2, 1, and slowly back down. If that's too tricky, you can come up to a sitting position and support your knee with both your hands in order to get the knee bending. And slowly down. You can do 10 to 20 repetitions. Your fourth exercise is called the clam. This is to strengthen up your gluteus medius muscle, which is an important stabilizer of your pelvis. First of all, bend your knee as far as you can comfortably. Get your hips in a straight line. Keep your toes together and just tighten your tummy and lift your knee. And slowly down. Tighten your tummy, lift your knee, and slowly down. Try and isolate the muscle that's working to the back of the hip. You can do 3 sets of 10. If that's too challenging and you're unable to bend your knee this far, you can bend the bottom knee up to stabilize. Have the top leg, which is the affected leg, straight. Tighten your tummy. Turn your toes slightly out and up towards the ceiling. Lift your leg and slowly lower down. And lift and slowly lower down. The other important thing is that your leg should be slightly behind you, not in front of you. That also helps to isolate your glute medius muscle. And you can do 3 sets of 10. Your fifth exercise is called bridging. This is to strengthen your gluteus maximus muscle. Start with a slight arch in your back. Take a breath in. As you breathe out, suck your belly button in towards your spine, flatten your back, lift your bum, squeeze into your bum, keep your ribs down, hold it for 5, 4, 3, 2, 1. Take a breath in. As you breathe out, roll down. You need to be partial weight bearing or full weight bearing in order to do this exercise. Take a breath in. As you breathe out, suck your belly button towards your spine, flatten your back, lift your bum, squeeze into your bum, hold it for 5, 4, 3, 2, 1. Inhale and exhale, roll down. Slight arch on your back, inhale, exhale, flatten your back, lift your bum, squeeze into your bum, ribs down for 5, 4, 3, 2, 1. Inhale and exhale, roll down. You can do 10 to 20 repetitions. Your next exercise is a hamstring stretch. Often your hamstrings get really tight following an ACL injury, so it's important to stretch them. Take your towel, loop it around your affected leg, lie down, and then just gently straighten your leg. It doesn't have to go high. You really want want your knee straight more than anything else. Hold that for 20 to 30 seconds. If that's too easy, you can make the lower leg straight, and you can obviously take it as high as you can comfortably so that you feel a nice stretch in your hamstring. Hold that for 20 to 30 seconds. This is your climb exercise. In this shot you can see the angle of the hips. When your hips are straight, it enables you to activate your glute medius more effectively. Keep the toes together, raise the knee, and slow it down. Keep your pelvis tight, and keep your pelvis steady. What you don't want that. Keep it tight, just lift the knee, and slowly go. With an ACL injury, it's important to avoid what we call open chain movements. An open chain movement is a movement like this. Basically, you're straightening your knee while your foot is moving freely through space. This movement puts too much pressure on an anterior cruciate ligament injury. So you really want to avoid that, especially if there's added weight or resistance. This movement, by contrast, is what we call a closed chain exercise. Your foot is fixed to the floor or even to a leg press plate, and you can do the same movement straightening your knee. This exercise is perfectly safe following an ACL injury. Your final exercise is called torture cushion. You can use a box, a coffee table, another chair, a few towels or pillows, anything that props your heel up a little bit higher. What you want is for your knee to be hanging free in order that gravity can pull your knee into a straightened position. This is to help you regain those last few degrees of extension, which is so often lacking following an ACL injury. You can hold this position for 2 to 3 minutes and repeat this exercise 5 times. The other thing you can do while you're sitting here is to put your ice pack on your knee. It can even be a packet of frozen peas. The ice will help to reduce the swelling, which will also help to improve your knee function and to improve the knee extension.